right, we are live.
Hello, everyone. Thank you for joining Atrium Health as we host a live panel to share the most up-to-date, accurate information about COVID-19. My name is Claire Simmons. I'm a director with Atrium Health's Enterprise Communications team, and I'll be moderating today's discussion. We have panelists from across the Atrium Health enterprise, including Wake Forest Baptist Health and Atrium Health Navicent, participating in our talk today. We're going to be focusing on three key areas: prevention, treatment, and vaccines. We encourage you to listen, to take notes, to share this link, and to ask questions throughout today's discussion. As a disclaimer, this information is up to date as of today, which is Thursday, December 10th, 2020. As you know, this information is rapidly changing, so we'll continue to update it as that information becomes available. I'd like to start today by introducing each of our panelists. Dr. Katie Pasaretti from Atrium Health. Dr. Pasaretti has been leading the COVID-19 response at Atrium Health since the start of the pandemic. In addition to her day and night job, Dr. Pasaretti is a frequent face and voice on local and national media outlets, including Fox News and ABC National News, where she shares the latest information about the virus and efforts to slow the pandemic. Dr. Christopher Ohl from Wake Forest Baptist Health. Dr. Ohl is an infectious disease physician and a professor of medicine in infectious diseases at Wake Forest School of Medicine. Dr. Ohl has experience in planning for and responding to emerging infections and is a key member of Wake Forest Baptist Health's COVID-19 task force. He is currently advising Winston-Salem, Wake Forest University, and several community businesses in their responses to COVID-19. Dr. Jeffrey Stevens from Atrium Health Navicent. Dr. Jeff Stevens specializes in infectious disease, serves as medical director of infection prevention for Atrium Health Navicent, and teaches as a professor at his alma mater, Mercer University. As Navicent's leading expert on infectious disease, he has guided the health system response to COVID-19 and is a trusted voice within the Georgia market. The first hot topic we are going to focus on today is about the prevention of COVID-19. Unfortunately, at this time, millions of people across the world have gotten COVID. If you are among those who have not gotten the virus, or even if you have, it is more important than ever to stay up to date on the most effective ways to prevent getting or spreading the virus. Dr. Pasaretti, if we could start with you, we'd like to hear your top tips on prevention.
Yeah, so the top tips that I have are ones that you all have heard repetitively, but are worth reinforcing right now as we're heading into very dangerous territory as far as it stands with COVID, with rising cases, rising hospitalizations, rising deaths. The things that are going to protect you, protect those around you, are really wearing that mask and wearing it appropriately over your nose and covering your entire mouth. When you're really within 6 feet of anyone outside of your household, that mask protects you and it protects those around you. The other things that are going to continue to be important are, maintaining that distance between people. So COVID is spread primarily through respiratory droplets when you're in closer contact for longer periods of time. So the further you are away from potential sources of infection, the lower the risk of getting the infection. And, related to that are the larger group gatherings where we've seen time and time again that there can be easy transmission to a number of people. Those same things that you have heard us infectious disease experts harp on time and time again continue to be very, very important.
Dr. Stevens, what about from your end?
Well, I echo that, and I think people, again, are tired of all that, and I think that's an issue that we have to really try to, especially with vaccines on the horizon now, we really need to redouble our efforts to try to mitigate and decrease as much spread as we can. And masking is a very simple and safe and easy way to do this. Again, Dr. Pasaretti is exactly right. I mean, trying to do that and avoiding the gatherings. And I think with the holidays, that's especially difficult. And we've noticed after Thanksgiving, the big surge, and with Christmas coming, we really, the CDC is recommending folks not travel, not get into big groups, especially indoor areas. I think that's really important. And, again, the sort of the 6 feet, 2 meters, some places in the world, do 3 feet. But again, that's sort of an easy thing to remember, 6 feet back, so social distancing, masking, hand hygiene, also, they're all still important. Again, and if we can do that and do that well and consistently with the vaccines on the horizon, we'll really begin to see us get through this. So really, we need to redouble our efforts now. And again, but the fatigue and the frustration, I mean, that's understandable. That's human nature. But this is really a time that as citizens, and we need to really kind of get it together and do this over the medium term.
Some great reminders. Thank you, Dr. Stevens. Dr. Ohl, what about from your end?
Yeah, so hard to add to any of what's already been said. The thing is it's really simple stuff, and it's like, hey, you're a little too close to me. Hey, where's your mask? And let's wash our hands. And, I have a thing that I talk about for hand hygiene is just like we do in the hospital, wash in, wash out. You get in your car, do hand hygiene, get the hand sanitizer out. You get out of the car to go into the store, hand sanitize before you go in. And every time you do something new or different, hand sanitize before and after. And then I think the other thing is trying to avoid those, oops, what was I thinking moments? Because those of us who do a lot of contact tracing, we hear about this. So, hey, that was my brother-in-law. He wasn't some foreigner, and I got COVID from him. So we're trying to prevent bubble fusion moments. So there's a bubble around you and your family. You want to keep from fusing bubbles with other people. And some of the places that people get exposed seem really innocuous. Hey, it was just lunch with some coworkers. There are only 6 of us, but you take your mask down when you eat and you sit at the table for a while. And so so I tell people, when you're going to do something, think once, think twice, think 3 times. And then if you still think you should do it, make a plan and stick to it. So you don't have one of these, well, it was around the fire pit, but then it got cold, so we took it in the kitchen. And those are all simple things that we can do. It does work. It helps.
Excellent. Thank you. While we're on the topic of prevention, I'd like to ask you each a little bit about testing. There's been a lot of information coming out about testing. And of course, as the testing capabilities have changed over the past several months, I think that adds another layer of confusion. So knowing that people likely do have some travel plans this month and into the new year, what would be your tips on when to get tested, what type of testing, anything like that to help set the record straight?
You have to be a cautionary tale there that if you're tested today doesn't mean that you couldn't develop signs and symptoms tomorrow. And we did that for our university students. We had a very aggressive, here at Mercer, we stood up a very extensive PCR lab so we could do testing. We could do 2,000 or 3,000 tests a day if we needed to. And football players and people were getting tested all the time. And we offered a test before people went home for the holidays. And I tried to make sure that people understood is that if you were tested that day and negative, doesn't mean you still don't do all those other things when you get home. And so testing is important, but it's not doesn't allow you to go out and do whatever you want, because it really is a snapshot of that day. And that's something that I think we've not been really good enough and been as, loud enough in letting people know that. So I think it's important, and it's a good idea sometimes, especially if you've traveled or you, as Dr. Ohl said, you're around some folks, you weren't sure, like, oh, my brother-in-law, well, then maybe you do get tested, or certainly when you're quarantined, maybe you do that at 7 days, that sort of thing. People are doing that, but it doesn't mean that you can't develop, 2 days later or the next day, signs or symptoms. So I think that's really important to let people know.
Dr. Pasaretti, I know you have some thoughts on this topic too.
Yeah, I completely agree. You cannot test away risk. The first, second, and third message should be really try to staying home, not traveling is the best way to prevent it. If you do travel, know what test you're using. So not all tests perform the same. The rapid tests are very attractive for a lot of reasons. You get everyone likes immediate results and, look, I'm negative, but there can be trade-offs in those rapid tests with having false negatives, so having a negative test and then turning positive, or having it kind of misrepresent your actual status. And then the other thing, the CDC does recommend, if you kind of choose to kind of take that risk and travel, that you test before you go and you test when you get back as well. That sandwiching for the just the reasons that were discussed. And then the only other thing I want to mention, not so much related to travel, but any symptomatic person, really, you should not be traveling if you have symptoms, period. But, a lot of people mistake sinus infections, bad allergies, symptoms are misconstrued as like my chronic issues and not necessarily representing COVID. And we see this in healthcare workers. We see this in our patients waiting, a week or so to get tested and then finding out they're positive because they kind of they're like, I didn't have a fever. It was, I get a sinus infection around this time of year. It just felt like a cold. Just to reinforce, COVID often feels like a cold. Only about a third of outpatients actually have fever. So just, be cognizant of your body, your symptoms, and that's probably the most important point, and where the tests are most useful in kind of identifying that and getting you out of the mix.
That was great. Thank you. Dr. Ohl, anything different to add on your end?
Not a lot. It's I think you figured out the theme here is the testing adds to safety, but it's not the cornerstone of safety as far as COVID goes. So it's kind of like going to the beach. You don't rely just on one thing when you're getting in the water. The best thing you can do is prevent those bubble fusion events.
Perfect. So I think to summarize in one sentence, a test is not your hall pass, but please go ahead and get tested nonetheless. Great, thank you. Well, let's go ahead and segue onto our second main topic of the day, which is treatment of COVID-19. Had we been having this conversation back in March or April, it would have been nothing like the one we are having here today. And most likely 6 months from today, it will also be very different. But let's go ahead and get a temperature check on how things have progressed. Where are we right now with treating patients who have COVID-19? Dr. Pasaretti.
Yeah, so it's a super exciting time as far as treatment goes. We are seeing more and more medications out there that are being studied to see the impact on COVID. So in the past, we only had, give steroids, remdesivir, which is a medicine that acts against the virus, and, convalescent plasma, or giving blood transfusion with antibodies to try to kind of calm down the immune system, give kind of stronger support to the immune system. Right now there are a number of different medications that really look at attacking the virus and ramping up the individual's kind of ability to fight off the virus and calm down the immune system that are being looked at. And, whereas most of our treatments in the past were focused on patients in the hospital, now we have research trials going on for patients out in the community where we haven't necessarily had treatment trials in the past. So new antibody medications, trials of antiviral medications that are available for people to look at, participate in, and add to science to know what can maybe help not just patients sick enough to be admitted, but those that are out in the community in the outpatient setting. So super exciting time, lots kind of developing day by day, and allowing for us to look at populations more across the board, whereas in the past we were focused on the sickest of the sick and helping them get through.
Dr. Stevens, what about your perspective? How are things advancing with treatment?
Well, I think Dr. Pasaretti really summed it up nicely. I think that, I think we also have a better feel for people in the hospital, again, people doing worse or better. And again, we have the steroids, we have the remdesivir, which is modestly effective and really has really helped get people out of the hospital a little bit faster. And some of the antibodies, again, as she said, are really for people who are not yet on oxygen, not yet sick, more to try to see to decrease the progression of illness. And again, there's some logistical things about getting that to folks and giving that to folks as an outpatient. But having that is helpful. And again, there are oral antivirals that are in trials. I'm doing some trials of remdesivir to see if it does decrease the progression to more symptomatic disease. So I do think we've come a long way. It would really be nice if we had something oral. It also would be nice to have some things that we could do easily as an outpatient. And so I think that we have come a long way. And I think we take better care of folks because we have a better feel for the patients. I certainly know I saw the first patient here in Macon in March, and it's amazing how much different now, hundreds of people later. I mean, we all get a feel for that. And I think that's why people overall have done better, because we have better general care of folks, and also we have more in our more in the armamentarium also.
Dr. Ohl, what are you seeing in the Winston-Salem area? How are things over there?
Well, they're kind of like they are down in Charlotte and down in Mercer. There's a lot of COVID out there. So the thing about treatment that I think people need to understand is there's two aspects of the virus. The first one is you get the virus and then it replicates quickly and gets through your respiratory tract, and then it goes away in most people in 5 or 6 days. And then right around day 7 or 8 is when some people, a smaller group, but some people will crash from inflammation, particularly in the lungs. So treatment's focusing on reducing the virus early and then reducing inflammation later. So if you try to reduce the virus and there's no virus around, you're not going to get anywhere. And that's kind of where our treatment trials would go. I would summarize saying that our current treatments, remdesivir and monoclonal antibodies, are modest. Even the monoclonal antibodies, which got a lot of attention due to certain people that we know their name of who got it, it only really in the trials reduced ED visits from 9% to 3%. Which is, that means you got to treat about 25 to 30 people to reduce one ED visit. So that's not the magic bullet. Steroids have been real helpful for the inflammation, and it really has cut down our ICU mortality and length of stay. So here's what I'm hoping for, and Jeff alluded to it. This is what I'm looking for on the horizon. I'm looking for an oral drug that I can write a prescription for, give it to you, you go to the pharmacy and get the drug and take it very early on, as soon as you're tested and as quick as to the symptom onset as possible. We reduce the amount of virus, we shorten the duration of your illness, and we shorten the period of time that you're infectious to other people. That's what I'm looking for. And then the other part about it is, hey, my husband, John, he came home, he's got COVID, I've got diabetes. What should I do? Hey, take the drug, we're going to prevent it in you. Here's the prescription, you take the drug, and then you don't get it from your husband, John. That's called prophylaxis. We as doctors do this with influenza all the time. We use Tamiflu to make the highest risk people do better, and then we use it in people who've been exposed to prevent them from getting it. Those trials are ongoing. I hope some of the stuff will be out by spring. A little bit of luck and knock on wood. So that's what to look for. That's going to be the game changer in treatment.
And Claire, if I could follow up on that, I think that's exactly right. And I think that that's the thing that people don't understand sometimes, is that folks respond to viruses and other infections in different ways. And sometimes it's genetic, sometimes it's your age, sometimes comorbid conditions increase your risk for that. But this is the thing about healthcare workers. Most healthcare workers, when they get influenza, are minimally symptomatic. But we want people to get vaccinated for flu, also to protect them, but also protect their patients, because you can pass it on to other people. And so this is why that, I've had other clinicians tell me they've never had flu, and I just chuckle at that because they just have not been very symptomatic in a long time, but they'll have antibodies to multiple, flu strains. And the same way as Dr. Old said, if we had that, and there is a drug that Merck has that looks attractive for this, and if we have that, then we can do, as he said, you can also do early treatment. And I will tell you that a lot of people, though, with the flu drugs, we've had poor uptake with that because you have to do it quickly. And some of that is access to care. Some of it is lack of knowledge that we have that. But with COVID being sort of on everybody's mind and such a broad thing, if we had that, I think people hopefully would take us up on that. And that would be another way, especially in the little super spreader or the bubble. I like that analogy, the bubble. You could help keep the bubbles from spreading. And so I think that would be a very nice thing if we had that.
Excellent. Thank you all for providing that perspective and hopefully a glimpse into what is yet to come. Our third topic today is vaccines. And for those of you in our Facebook audience who have joined us a little bit later, just to recap, we are coming to you live today talking about three main topics with COVID-19: prevention, treatment, and vaccines. And knowing vaccines are the hot topic, we'll probably spend the most of our time today on this one. And I'm going to ask our experts to cover everything about hesitancy when it comes to the vaccine, to who should get it, who might be first in line, dispelling some of those myths that I know you all have heard, and just sharing some updates on where we are. Where is this vaccine? And I know things are moving fast. So let's go ahead and get started. Dr. Pasaretti, we'll start with you.
Yeah, so, definitely super exciting time. We're, this week, the very first vaccine candidate from Pfizer is going in front of the FDA and the ACIP, or the kind of United States Immunization Expert Panel, for review, with all anticipation that it will be approved and start being available in our area in the next couple of weeks. So, this is part of what we have been waiting for, and gives a glimmer of hope at a kind of dark time as far as the trajectory of cases. The first vaccines that are available certainly they're a novel type of vaccine. So it's not our traditional type of vaccine where you inject a killed virus or a part of a kind of attenuated version of a virus, but it's a kind of interesting way of approaching vaccines, essentially giving genetic material that drives a portion of the COVID virus to be produced in your own body, and your immune system responds to that. So it's not a live vaccine. It's not something that can cause COVID in the individual. It's just a teeny tiny piece of the vaccine that your body can then respond to. And in early data looks really, really good as far as preventing COVID infection in individuals that get it by about 95%. So that's, pretty impressive results for a vaccine for this virus in particular.
Dr. Stevens.
Well, yes. I mean, again, I've not seen the total paper, obviously, since it's not been submitted, but looking at the safety and efficacy from the releases, it looks to be amazingly effective. We have very few vaccines that are above 90% effective. There are a couple, and they're sort of, best in class. And to tell people, the Food and Drug Administration, the bar was 50% effectiveness to get a vaccine approved. And 90% is really remarkable. And the safety data looks good. And I think people were concerned about the rapidity of all this, because I think in our most recent vaccine, the Ebola vaccine, took 4 years. I think a vaccine in the 30s took 3 years to get approved. But this is 2020, almost 2021. And we have the ability, especially as Dr. Pasaretti said, with these mRNA vaccines, to do this very quickly. And they did very big trials of 30 and 40 and 50,000 people. And those are big groups of data. We don't usually have, vaccine trials have that, but when we look at lots of other drugs, it's a lot smaller groups of folks. And so to have the efficacy and safety that we have at least so far seen is pretty remarkable. And it will really make a difference in this, and will begin to turn the tide, I would hope, in the next 3 to 6 months, And, if everybody does the mitigating factors we talked about earlier and the vaccines get going, we probably will be back to some sort of normalcy by next fall. And that's really amazing because 2020 has not been a good year. And I'm hoping that by 2021, we will begin to turn the tide here.
The key word there is normalcy. I don't know if any of us know what that means anymore, but it sounds really nice. Thank you, Dr. Stevens. Dr. Ohl, if there's anything you can chime into, again, to reassure people about the safety of the vaccine, as well as plans from Wake Forest Baptist Health about when you might be getting it, who might be getting it first, and just your general thoughts on it.
Sure. So when, actually it looks like tomorrow is when we'll get ours. And then we'll probably start vaccinating healthcare workers next week. So the first phase is healthcare workers, nursing home people, and nursing home staff. And I agree with that. And I think most of our medical centers are sort of sub-prioritizing within that, so that we get the people who would be at higher risk first, and the people who are the most critical to our functioning first. So I actually have pulled up the FDA submission from Pfizer for the vaccine, which is the one we're going to pull up here first. And I've gone over this thing with very carefully, did the numbers myself, and it really is 95% efficacious. And people have to understand, this is huge. I mean, this is like our measles vaccine and some of our best workhorse vaccines that we have. So just to give you a point how good it is, in the vaccine group, 7 people got COVID, whereas in the placebo group, it was just under 200. I mean, that, for us in ID, that's a home run. So there's no question about efficacy. So here's some of the things that I hear from people that are concerns, and I understand that. One is, man, this vaccine was really rushed through. They weren't careful, were they? Actually, we did rush it through, but the technology that we have available to us now to make vaccines is so robust that we can do it pretty quickly. And so it's a new era in vaccine production and manufacturing. The clinical trials that we looked at these vaccines weren't rushed. They were done carefully. They were done with the right number of people, and they were done across the board. Older people, younger people, and people from different colors, different ethnicities. So we have a really good look at how the vaccine looks against the cross-section. A few people who weren't in the trial, pregnant women and kids, that data is going to have to wait a little while yet. But so that's one question. So even though we did it quickly, didn't mean we cut corners. The trials were done well, and they were done how we do good clinical trials. So the other thing that I hear about, well, it's a messenger RNA vaccine. That's kind of new, right? You're putting RNA into me? Well, yeah, but what people don't realize is we've been working on and working with messenger RNA vaccines for almost 30 years now. In fact, when I was a fellow, I was working on the bench on a messenger RNA vaccine. That was a long time ago. And so even though we haven't put it out there for the general public, a lot of this was because of business decisions and not necessarily because of safety or efficacy decisions. So I'm pretty confident in the technology, actually. So lastly is, while we don't know about all the side effects yet, well, there's almost been 40,000 people that we've looked at side effects. I can tell you one thing to expect, and it's technically not a side effect, but sort of an expected thing that happens after vaccine. You're going to get a little sore in your arm, particularly with Pfizer's vaccine. And about maybe 15% of younger people, 10% of older people will have a fever the day after the vaccine. The length of those symptoms is about a day to a day and a half. So it's very short-lived. Very, very few people miss any kind of work or activities. maybe you won't be playing tennis the next day, but you'll be able to go about your business. And what that means is it means the vaccine's working. This is the immune response. So it's just think of it that way when it happens. As far as serious adverse effects, really there weren't any in the trial. I know in the UK they talked about a couple of allergic reactions, and we see that with any vaccine. And that's why we have people hang out for 15 minutes after their shot. And people who have a lot of allergies. So if you're asked to carry around an EpiPen all the time because of bee allergies, peanut allergies, and what have you, that's something to let your doctor know about. But otherwise, it's not an issue. So here's how confident I am. I am rolling up my sleeve right now because I am ready to get the vaccine. And as soon as my family is eligible, I will be vaccinating them. And so this is something that we need to do for your own safety, for your own health, to benefit yourself. Be selfish here. Get the vaccine for you, but also for us as a community. This is our ticket out. This is how we're going to get out of this mess, this COVID mess. And together with continued social distancing and masking, which we'll still need to do for a while, probably until the fall at least, that's going to be the pillars of the legs of that stool: distancing, masking, vaccine. The three of those together are going to work multiplicatively and rather than additively, and make a very strong stool that we're going to conk COVID on the head with. And that's our ticket out of this. And so that's what I tell people. And if you're from a different ethnic group or color, you got to realize the trials included those groups, and they worked, and it was safe. And so I think we're going to have to continue to talk with our patients and talk with the public through public health messages, and just keep letting people know it's a safe and effective vaccine, and it's time to do it. And next week is when we start.
Very reassuring. Thank you for that great information, Dr. Rowland. And the rolled up sleeve is such a good touch. I would do it, but my shirt is a little restrictive. So it's all you. All right. Well, we have actually gotten lots of questions from our live audience, but we've answered pretty much all of them. So here's what we're going to do for our last, what I'd like to call a rapid fire round of questions. I'm going to invite each of our panelists to say one thing that we have not talked about today about COVID-19. For example, it could be talking about tips for people who have COVID who are at home recovering. What can they do? Or how virtual care within our respective institutions have advanced during this time. Anything along those lines. There is no wrong answer. Just to add one final piece of information to our audience who's really hungry for this would be great. So Dr. Pasaretti, you're up first.
Yeah, so I will pick that virtual hospital information. So I think this is one of the, there has been a lot of challenges and sadness during the past 9 months, but there also has been a lot of hope and a lot of advances. And one of those things is that how we use technology in medicine to provide care. So the ability to see a provider online, and there's multiple ways to do that, whether it's, like we're on Zoom right now, having a virtual visit, an email visit, and get that same quality of care, that same medical opinion from the comfort of your home, and being able to do that more broadly. I think that has been tremendously impressive. At Atrium, taking that beyond that level for the purposes of COVID. And, obviously we've talked about how COVID is spread and bringing people with COVID into healthcare facilities. We're pretty darn busy right now. So if we don't have to have a patient in the hospital, it's important to keep that them at home. And obviously, preventing spread of the infection is important. So the Atrium Hospital at Home allows people with COVID to be cared for in the comfort of their own home. And that includes people with mild symptoms and people that we traditionally would have admitted to the hospital, having paramedics go out to the home, make sure they have oxygen, check on them, provide medical care, and have that same level of monitoring protection that you would have had in the hospital. I think that's hugely beneficial to patients. It's helpful to our hospitals in that, we're crowded. We have a lot of patients with COVID right now, to continue to be able to provide great care for everyone. So I think tremendous advances have been super important. Encourage people to continue to use those avenues of care where it's appropriate. It's not always a perfect for some, more severe illness, but it's good for a lot of people and a lot of reasons.
All right, Dr. Stevens, you're up next.
I'd like to echo that. We've had the similar thing here. And I do think that with technology, that does allow us to perhaps keep people out of the hospital that in the past we would admit, and allows us to check on them and follow them very, very easily. And it's worked out well here. I wanted to point out another reason for the vaccine that I think that people sometimes will say, well, it's only the flu, or not that, that you may not get that ill. About, probably 30-40% of people who get COVID are asymptomatic or minimally symptomatic, and the rest would have some symptoms. But what's interesting is that up to a third of people who are symptomatic will continue to have symptoms over the long term, and that may be 3 months or more. And this is an area that we don't know much about as far as what to do for them. But about a third of people who've had COVID will have cough or fatigue, being the big two symptoms, at least sometimes 3 months or longer after having the illness. So this can be, for a lot of people, a chronic problem. And we've seen that with other infections, post-infectious fatigue, other signs and symptoms after, various illnesses. And so I think that's going to be a challenge to us. And that's another reason that, as your mom said, an ounce of prevention is worth a pound of cure. That really, I think in this case, as in many others, is very important. And so I think that's another reason to try to prevent it rather than let people just have it, and sort of run its course. That's a really bad idea for many reasons.
All right, Dr. Ohl, any last minute information you would like to share that has not been discussed yet about COVID-19?
Yeah, there's a lot. So we, there's been some confusion, I think, over the last week about the change in quarantine times from the CDC. So I just thought I'd mention that. So for most people, 14 days is still good, 2 weeks. But if for some reason you're in a critical position, let's say you're a firefighter, and we do like our firefighters to go to work because they keep our houses from burning down. And then there's an option to quarantine just for 7 days and get tested on day 5. And then for some people, 10 days might be sufficient. 14 is particularly if you're living and around a lot of other people and have more chances to spread it. So the website, the CDC's website, kind of lays it out. The other thing is our health departments are having trouble doing contact tracing right now and getting in touch with people who have been exposed. And so you might not hear from the health department when you've been potentially exposed. So if you think you've been exposed to somebody, so like if your friend tells you, hey, I tested positive, don't wait for the health department to put yourself in quarantine. Just go ahead and do it. And you can do one of those options that we just talked about, because we really do want to slow the spread of this virus. And quarantine, even though you may not hear, quarantine is still really important. And certainly, if you've been symptomatic with any kind of flu or respiratory-like illness, just assume you have COVID. And if you can't get tested, pretend like you have it and hang out at home for 10 days. And so, be a good citizen. So I think those would be my messages today. And then my last one has to do with the venue here. This is so cool for all the 3 of us to be doing this together, Navicent and Atrium and Wake Forest. And I really look forward to doing education things together for COVID and for other things too. And hopefully in a year we can say, well, what did we learn from COVID now that we're out of it? And that's what I'm looking forward to.
I look forward to the reunion too, when maybe we're talking about how we cured COVID. Wouldn't that be nice? Thank you. Well, this has been a first for the Atrium Health Enterprise too, having all three of these organizations together: Navicent Health, Atrium Health, and Wake Forest Baptist Health. Thank you to Dr. Stevens, Dr. Pasaretti, Dr. Ohl. So much really helpful information. This is such an important topic right now. We want to make sure that we're not scaring people. We're educating all of you so you can make the best important decisions for you and your loved ones, and we'll all get through this together. So with that, let's go ahead and close out for today. More information to come as always. Thank you for joining us, and we look forward to connecting next time. Have a great afternoon.